CBS 4, this is Aging Independently with Christine Bartel, empowering seniors to live on their own terms in their own homes. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Hi everybody, and welcome to our show. If you are an informal caregiver for a senior, you are not alone. Nearly 66 million Americans provide care for a family member, friend, or a neighbor, and fulfilling that role is not easy. It can burden you financially, emotionally, and even physically.
So you find yourself in that caregiver role. Maybe it was thrust upon you because of a disease or a crisis or a hospital visit. So all of a sudden you are spending the time that you might have spent taking care of your family or working or taking care of your own needs, you're giving that to the other person. You're taking really good care of them. So you're putting their needs first a lot of the times, whether that be not getting enough sleep because you're having to get up early to do things for your own family and staying up late to be taking care of that loved one. Maybe you're just not getting enough nutrition. You're not eating. You're upset. There are emotional parts of it, and that sometimes causes us to lose an appetite or eat too much of the wrong things because we don't have time to cook a healthy meal. So your body starts being that physical impact of stress. Walking around trying to juggle all those roles and take really good care of another person who's relying on you, that's a burden. Taking on that role of nurturing someone else, we do it out of compassion, out of love, out of that sense of family duty, whatever that is. It comes from a really good place. But unless we bring balance into it, then it sort of becomes out of control. Unless you have something to give, you can't take really good care of someone else.
Thankfully, there are a few simple recommendations that can help as you fulfill your role as a caregiver. And here to talk about them is Dr. Kevin Henning, the Chief Medical Director with Amedisys Home Healthcare. Thank you for being here, Dr. Henning.
Thank you. I'm glad to be here.
Let's talk about these tips. Staying organized.
Yeah, that's an excellent point, Christine. It's critical to stay organized. Being a caregiver really can be quite overwhelming. Often caregivers are taking care of individuals who see many different physicians, go to different hospitals, have many different medical problems, are taking a number of medications. You need to stay organized, make yourself to-do lists, keep track of things. Write down your loved one's medications. Keep those handy and accurate. They change frequently and can be a source of great confusion amongst the different healthcare providers.
Right, and especially if you're going to a new physician or a specialized physician, they want to know what you're currently taking.
Absolutely. Medication errors amongst people that are chronically ill are quite common, and the caregiver really does need to take good care and keep track of these medications. Physicians and other healthcare providers don't communicate like they ought to. Often that falls to the caregiver to make sure people are communicating and keeping track of medications.
I would say that is almost the single most important thing to keep track of.
It is. It's a common cause for rehospitalization. It's a common cause for patients to get sick when their medications become disorganized and duplicated and so forth.
In addition to that, we have to be prepared for changes, take your time and be thoughtful when you're caring for somebody. What about support, respite care? Oh,
it's very important. Again, as you alluded to earlier, being a caregiver is a significant burden. It takes a toll on caregivers from a physical point of view, from an emotional point of view. It's easy for caregivers to feel resentful and angry. It's a 24-hour-a-day job often for many caregivers. That takes a huge toll, a burden on the caregiving, and you need to take a break. Really get some help from friends, take some rest, take care of yourself.
Eat right, get exercise, and then be a caregiver all at the same time.
Absolutely. It's so easy for caregivers to neglect their own health. They need to take care of themselves. Thank you so much for being here, Dr. Henning. My pleasure.
For more information on your home health care options, call the Amedisys information line at 1-877-877-8145. You can always go to our website for more information to take today's poll question and learn more about aging independently by watching all of our shows. Just head to cbsdenver.com and click on Aging Independently. Be sure to join us next time for more information on staying independent in your home.
Thank you for watching Aging Independently with Christine Bartel. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.